Often patients ask this question, what is hair loss and what is hair fall? I am Dr. Viral Desai. I'm practicing plastic surgeon, board certified cosmetic and plastic surgeon and hair transplant surgeon, practicing for over 20 years now. And I always answer this question explaining to patients that the hair roots gradually thin out as they age. With every cycle where they become weaker and weaker, from being strong, they become weak. Once they become very weak, they completely fall out, and that is called hair loss. When the root is completely lost, then there is no other option but to put a new root. So if you think of hair loss and hair fall, think of a plant, okay? Once the roots are dead, then the plant will not grow. There will not be any leaves, there will not be any fruits, there will not be anything at all, no flowers, nothing. So the roots are important. Similarly in hair, the roots are important. Once the root falls off, the hair is lost permanently. You have to take new roots from other parts of the scalp or body and put there and do hair transplant. But before this stage is reached, the hair will gradually thin out, it will weaken and the roots will be lost. So this is a stage where you can preserve with medical therapies and you can prevent the hair fall. So hence the world today is going towards catching the patient early at a young age and preventing hair fall rather than waiting for the root to go completely and then doing a hair transplant. There are various ways. So why does this hair fall occur? The main reason why hair fall occurs because it is genetically predetermined. That's why we call it genetic hair loss, male pattern or female pattern baldness, hormonal hair loss. We also call it patterned hair loss. Okay, there are many names given, or androgenic alopecia. So the main cause here is genetic predetermination, but other factors like stress, diet, nutrition, hormones, local scalp care, local scalp conditions, infections, generalized body infections, body nutrition, and so many other factors, sleep, etc., increase the hair fall or tend to lead to more hair fall in such cases. So we not only need to treat the root cause, which is the genetic or the hormonal imbalances, but we also need to look at the other environmental causes. So we need to improve the nutrition, we need to make sure that the environment is stress-free, we need to make sure that the patient is sleeping well, he's well rested, the scalp is healthy, the scalp conditions are healthy, and so many other factors that we must take care of. The hair humidity is maintained, the hair should not be dry and brittle, etc. has to be taken care of. There are various ways which you can do at home to prevent or decrease hair fall. 1. Sleep well. Sleep at least 8 hours in a day. 2. Have a lot of water. 3. Have lots of proteins. Most of the body tissues are made of proteins. Hair is also more than 80% proteins, so have a lot of proteins. 4. Have a good balanced diet with good amount of nutrition in terms of your vitamins, your minerals, etc. Deficiency of B12, deficiency of calcium, deficiency of magnesium, zinc, all these can lead to hair fall and hair loss. Selenium also is known to be very important for hair fall. So all these should be enough in your body. If you are a vegetarian diet, make sure that your B12, calcium is taken care of, because often in vegetarian diets, B12 and calcium is lacking. So you may need to take supplements, you may need to do this. Now, if you are a female patient, especially the younger age or at the menopausal time, hormone changes can be a big cause of hair fall. So make sure that you've checked all your hormone problems and treat them well, otherwise the hair fall will never stop. So today the whole world is going into prevention of hair fall and treating hair loss early before the root is actually lost. We have so many therapies, right from PRP, platelet-rich plasma, then GFC, then we have exosomes, we have mesotherapy, injectable dutasteride and finasteride, topical medicines, cyclical therapy, minoxidil, peptides, redensil, herbasol, and so many other therapies which are there. In our clinic, we were the first to introduce exosomes, which has revolutionized hair transplant globally. We also use a very high level of PRP, which is a CE or a European Union certified class 2B device, So the concentration of platelets is very high, and hence you get very good results with this kind of a treatment. We also introduce high dose of topical finasteride and topical dutasteride with MO oil, which really helps to prevent and keep the hair fall. So such new therapies along with the older therapies like minoxidil. Nowadays a lot of oral minoxidil is used because it is more efficacy. There's more efficacy than topical minoxidil. So these are the various therapies that are there, which will basically help in prevention of hair fall. So our whole concentration should be tell the patient to start treatment early, take good care at home and also with medications, and prevent the root from falling completely rather than waiting for the root to fall and then do a hair transplant. If you like this video, do comment, like and share this. Please educate everyone around you. There are a lot of myths and a lot of facts which are not understood properly about hair fall. So please do this and follow us, visit our website or book an appointment with us to know more. Thank you.